In today's video, we're diving into chronic fatigue syndrome, or CFS, which is a complex and often misunderstood condition. It's a debilitating disorder that goes way beyond just feeling tired. Imagine yourself during your worst proper flu episode and how totally knocked out you felt, but it never goes away. That's the kind of exhaustion we're talking about. We'll be looking at what are the associated causes, what are the common symptoms, how it's diagnosed, and most importantly, how it can be managed. And if you stick around to the end, I will share some top self-care strategies and resources to immediately help those of you who possibly have already been diagnosed, or if you strongly think you might have CFS. Hey everyone, it's Dr. Richard here, and today we're diving into the often misunderstood world of chronic fatigue syndrome, also known as CFS or ME, which is myalgic encephalomyelitis. As always, please note that this is not a video diagnosis or consultation, but is just for general information and guidance, and we're providing it to you. If you feel you need a diagnosis or consultation, please see your family doctor. So, imagine feeling exhausted like you've got the worst flu infection, but this never goes away. Or you constantly feel totally drained, no matter how much sleep you get. If you suffer from this, you're not alone. Millions around the world experience some form of chronic tiredness, but for some, it's a sign of something more complex condition called chronic fatigue syndrome, or CFS, also known as myalgic encephalomyelitis, which is a mouthful, or ME. That overwhelming exhaustion is just one piece of the puzzle when it comes to CFS ME. It's not just being tired, it's a serious long-term condition that impacts your energy, your brain function, and almost your entire body. CFS and the term ME are often used interchangeably, though they can have slightly different clinical interpretations. Simply put though, they involve your immune system, hormones, and your nervous system not working as they should, and this then is leading to debilitating fatigue and a wider range of other often debilitating symptoms that go far beyond just feeling tired. CFS ME affects women at least 3 times more often than men, and most commonly shows up between those in their teens and late 30s. The tricky thing is, CFS ME can appear different in each individual sufferer. Some people experience milder symptoms, while others truly struggle with severe, life-altering limitations. This makes diagnosis and treatment really challenging, even for doctors. Imagine experiencing a roller coaster of symptoms that come and go, sometimes leaving you bedridden, while the rest of the world sees you as what they term as healthy. Your body feels like it has run or is running a marathon, even on your best days. Simple tasks feel exhausting, you're hit with brain fog that makes concentrating impossible, and even the thought of socializing feels overwhelming. Frustrating, right? That's the reality for many with CSF ME. And sadly, their struggles are often invisible, leading to misunderstandings and misdiagnosis. So that's why awareness is so important. So let's shed some light on the most common symptoms. CSF ME is mainly characterized by persistent, debilitating fatigue that lasts at least 6 months and crucially does not improve with rest. If you or someone you know experience any of these next symptoms, it's crucial to seek medical advice. As I mentioned before, CSF ME is a very complex problem, and so just having one or some or all of these symptoms isn't diagnostic, as there are many possible causes, but it certainly will help guide you and your doctor. So as I said, extreme inexplicable fatigue. This isn't your typical end of day, working day tiredness. We're talking about level exhaustion that makes even basic self-care, like showering or getting dressed, feel impossible. It's relentless and significantly impacts your ability to function. Secondly, is something called post-exertional malaise, or PEM. This is also a defining symptom of CFS, a significant worsening of symptoms, sometimes very dramatically, after either minor physical or mental exertion. Imagine that a short walk or even a phone call could trigger a flare-up that then leaves you bedridden for days or even weeks. That's the impact and potential of the PEM. Thirdly, is something called orthostatic intolerance. This involves feeling things like dizziness, lightheaded, or faint when standing up, sitting up, or even sometimes just when sitting or walking. In severe cases, it can feel like the room is spinning or like you're on a boat at sea, in vertigo-like. and this can make it hard to even just move around your own house. Number 4 is things like muscle and joint pain. CSF-ME often comes with persistent aches and pains throughout the body, particularly in the neck, shoulders, and hips and knees. Again, it can be mild, moderate, but it can be extremely severe, and this is persistent discomfort adds to your overall exhaustion of the sufferer. 5 is things like cognitive difficulties, i.e. things like brain fog. Imagine struggling to think clearly, find the right words, or remember simple things. Brain fog is a hallmark of CSF-ME, impacting your work, your relationships, and daily life. This can be a really terrifying symptom for some people, as some might think they are losing it mentally or have early dementia or something like that. Cognitive issues can often involve the poor memory and concentration, confusion, disorientation, and then difficulty multitasking and making what are called executive decisions. CSF-ME can affect various systems in the body. Some other common symptoms often reported include chronic sore throat and things like swollen lymph glands, often in the neck. Others, frequent intense headaches, often with sensitivity to light and sound, often a bit like migraines. Sleep disturbances, including difficulty falling asleep, staying asleep and waking up feeling very unrefreshed. Then there's things like your gut, your gastrointestinal issues like nausea, vomiting, constipation, and diarrhea. There's also sometimes unexplained shortness of breath or rapid breathing, even with minimal activity. Sometimes this can be accompanied by something called air hunger, where you really feel like you can't get oxygen into your lungs each breath. Other things are things like hypersensitivity to sensory stimuli, such as light, sound, smells, and touch, and temperature changes. And then there can be unexplained things visually, like skin rashes, dry and itchy patches of skin. Think of CSF-ME on a severity spectrum. You have mild, you can manage most daily tasks, but your energy is limited, and you might need to cut back on your work and/or social activities. You have moderate, which daily tasks become difficult. You need frequent rests and breaks, and working or holding down a full-time job might not be possible. You have severe, leaving the house is a huge challenge, simple activities are draining, you might experience severe cognitive difficulties. And then the very end of the spectrum is very severe, where you might be mostly bedridden, struggle with basic self-care, and are very sensitive to light, sound, and touch. Physically and psychologically, at this stage, you can be in a very bad place. Now let's talk about what might be the causes of this complex condition. While we don't yet have a definitive answer for what causes CSF-ME, researchers are actively investigating several potential contributing factors. These include things like infections. So many people with CSF-ME report that their symptoms started after an infection, often a viral infection, and particularly things like Epstein-Barr virus, which is EBV, which causes glandular fever, or is commonly known as mono. Now, the recent pandemic, the COVID pandemic, has also highlighted a strong connection between things like long COVID and CSF-ME, and this further supports a theory that there's a link between infection and this disorder. Number 2 is kind of aligned, and that's immune system dysregulation. So studies that have been done on people with CSF-ME have shown that they have abnormalities in their immune response. This might involve lower levels of specific immune cells and chronic inflammation in the body, or even an overactive immune system in some cases. Thirdly, things like hormonal imbalances. Research has suggested that imbalances in stress hormones like cortisol, sex hormones, and thyroid hormones may contribute to the development or severity of CSF-ME. There is also research going on for the 4th one, and that's genetic predisposition, where your genes are coded and make you more susceptible to it. CSF-ME seems to run in families, suggesting genes likely play a role in making some individuals more susceptible to developing the condition. Thankfully, research into CSF-ME is gaining momentum, especially since the global pandemic and the very similar issues with severe cases of long COVID. This has led to increased funding and awareness of CSF-ME, and the scientists are hopefully getting closer to understanding the underlying mechanisms of this complex condition, although much more work is still needed to be done. Now, diagnosing CSFME can be a long and frustrating process, unfortunately, as there is no single diagnostic test. And this is really tough on patients as well as the family members and even the frustrated medical teams. Hopefully, with the already mentioned increased funding and research in these areas, scientists may one day come up with a diagnostic lab test or similar. But until then, doctors firstly have to rule out other possible causes of your symptoms, and they often rely on these. So firstly, a thorough review of your medical history, including your family history. Secondly, a good physical exam assessing your overall health. Then they will do a number of blood tests and other investigations. Then these are mainly to rule out other conditions they can identify by these tests. And lastly, assessment of your symptoms and their duration, including their impact on your life, and often using some established diagnostic criteria. Getting a diagnosis is crucial as it validates your experience and helps you access the right support. Sadly, many people with CSFME face skepticism and are then often misdiagnosed. If you suspect you might have CSFME, it's vital to do these things. So firstly, keep a detailed symptom diary. This means tracking things like your fatigue levels, episodes of PEM, your sleep patterns and other symptoms, and also identifying and documenting any triggers that seem to worsen your condition. Secondly, advocate for yourself. Don't be afraid to ask questions and seek second opinions if necessary, but find a doctor who listens to your concerns and takes your symptoms seriously. Although there is no cure for CSFME yet, the good news is there are many things you can do to try and manage your symptoms, improving your quality of life and making you feel more empowered. Firstly, as I said, find a compassionate and knowledgeable healthcare provider. It's essential to have a team of healthcare professionals who understand CSFME. They believe in your experience and they're dedicated to working with you and managing your condition. Secondly, make pacing your new best friend. Now, pacing involves learning to manage your energy levels by breaking down tasks, prioritizing rest, and avoiding overexertion. Think of it like a slow marathon, not a sprint, as they say. Pacing can be tricky though, but with practice and the right support of a therapist and/or occupational therapist, it can be a game changer in managing your symptoms and especially PEM. Thirdly, explore all management options. There are multiple different options. Some involve medications. Now, your doctors may recommend medications to help with specific symptoms, like your sleep disturbances, any pain, or maybe your cognitive difficulties. But these are often limited in their effectiveness for CSFME. Other therapies, like talking therapies, cognitive behavioral therapies, CBT, and other therapies can be very helpful in managing the emotional and mental challenges of living with CSFME. Fourthly, address any coexisting conditions. It's common for people with CSFME to also experience other conditions like fibromyalgia, irritable bowel syndrome, IBS, postural orthostatic tachycardia syndrome or POTS syndrome, or mental health challenges like anxiety and depression. Now, treating these conditions effectively can significantly improve your overall well-being. So next would be to seek support and connect with others. Living with CSFME can feel really isolating, so remember that you're not alone. Connecting with support groups or online communities can really provide a safe and understanding space to share your experiences, get advice, and find encouragement from others who get it. Don't be afraid to ask for help, especially from loved ones when you need it, whether it's with errands, childcare, or just a listening ear. Lastly, make sure you have regular follow-ups. Keep your doctor updated about any new symptoms or medications you're taking, as knowledge is power here. While living with CSFME, it can be challenging and impacting your work, relationships, finances, and mental health. With the right management strategies, support, and a whole lot of self-compassion, you can still live a meaningful and fulfilling life. It's about adapting, finding joy in the little things, and never giving up hope. So as I promised you in the beginning of the video, here are some bonus self-care tips you can use to take better control of your chronic fatigue syndrome. Tip number 1, pace yourself. Don't overdo it. Break down your tasks into manageable chunks and prioritize your rest. Tip number 2, listen to your body. Pay attention to your energy levels and don't push yourself beyond your limits. Tip number 3, establish a relaxing bedtime routine and create a sleep-friendly environment. Tip number 4, gentle exercise. Try low-impact activities like yoga or gentle walking. but only as tolerated and without pushing yourself. Tip number 5, connect with others. Joining support groups or online communities to connect with others who really understand your journey. So here's your call to action. Let's support each other. Share your experiences and challenges and triumphs in the comments below. What resources have been most helpful for you in managing your CSF-ME? What questions do you still have about this complex condition? If you enjoyed this video, please don't forget to like and subscribe, and do let us know what other topics on health and well-being you would like us to tackle. As always, please remember this video is for general information purposes and should not be used for diagnosis or seen as a consultation. If you're seeking medical consultation or diagnosis, please see your own family doctor. Take care and be safe, everyone.